At Life Without Barriers, we put children first. We want each and every one of those children to feel as safe and respected as they should. Children and young people have the right to be heard, and this means that organisations need to find ways to actively seek out the voices of children and young people. As an organisation that wants to be safe for children, we wanted to find out how children and young people feel about their safety and happiness. In 2019, we listened to the voices of 1,606 children and young people in out-of-home care with us across Australia. This included 1,468 in foster care and 138 in residential care. We asked children and young people aged 7 years and over, do you feel safe where you live? For those in family-based care, we asked, do you feel part of the family where you live? For those in residential care, we asked, do you feel supported where you live? We also asked children and young people aged 7 years and over to complete the Children's Happiness Scale. The Children's Happiness Scale was developed in the UK and asks children to rate statements that relate to happiness as true for them or not. For each child and young person, we asked their Life Without Barriers caseworker for their assessment of the child or young person's safety and well-being. If a child or young person stated that they did not feel safe where they lived, or if the caseworker thought that the child or young person had significant safety or well-being issues, we asked managers to act. We learned that 99% of children and young people reported feeling safe where they lived. 99% of young people in family-based care felt like part of the family, and 93% of children in residential care felt supported. Case managers felt that 97% of children and young people had no significant safety or well-being concerns. The happiness scale told us that 88% of children and young people agreed that they are treated fairly, have lots of fun, and that life is good for them at the moment. 80% of children and young people felt proud of themselves and that they were good at learning new things. We're analysing the data in more detail to identify where we can do more to support children's safety, happiness and well-being, and how factors such as age, gender, disability or time in care impacts how young people feel. You can learn more about the LWB Children's Voice findings by visiting our website.